Health insurance has been a crisis in the United States for a very long time. And for years, there's been big propaganda from the media that we have to do something about it. And no matter what it was done, it turned out to be a disaster, one disaster bigger than the other. In 2010, the House passed the Affordable Act Care, or as most people refer to Obamacare. And apparently it was supposed to be a very good thing to help people, the lower income who cannot afford health insurance. They should be able to afford health insurance. And a lot of people opposed it and said it's going to be a disaster. And after it was passed, we were hoping we were able to somehow stop it before it gets in effect, which happened in 2014. But nothing was done, nothing was able to be done. And sadly, the Supreme Court agreed with the care, which I don't understand how, but it's all a different discussion. And it turned out it was a disaster. I was one of the people who claimed that back then, that it's going to be a disaster. And I didn't even know how far it's going to go. And yet, in the recent times, the last few years, the crisis is still going on, and you rarely hear from it. It's like the whole politics in the United States have completely switched to social issues, such as abortion or, equal rights and all that stuff. And almost no one is talking about physical issues, and mainly about health insurance. But the crisis is still there. The Affordable Act Care made a disaster. First of all, it closed down. Most private doctors had to close their offices and go to work in clinics. I remember when I needed certain tests, like MRI, which I needed once, or a sonogram, or any of these things anybody needed. You had all over the place a place where they used to have these testings. Everything was an individual company. Today, they're all owned under a few hospitals, and it's like across the country like that. Every clinics all are owned by big groups who own a whole bunch of small facilities. And then regular doctors, of course, are all shut down. I mean, there's very few private doctors except the very expensive ones, that came from the Affordable Act Care. So how exactly is that supposed to help the individual person? It didn't help anything. It was just, it shows that the whole Affordable Act Care wasn't even passed to do anything good for the people. And to say it is short, before I get into a little more details about the paying part, the whole healthcare in the United States is so mixed up. It's like when you start talking about one thing, you get stuck with another thing. You start talking about the other thing, you get stuck with a third thing. It's like everything is twisted one into the other. You can't really get a clear picture of how the healthcare system in America is set up. And that was precisely what the Democrats tried to do all these years, is to cause confusion, that nobody should have a normal answer. You start asking questions, you get stuck with something else. And that's how everybody's confused, so they should be able to take over the whole thing and overthrow the whole insurance system, and everything should be under the government. So that's the best way to create confusion. It's like dolphins, when they go hunting with fish, they create confusion with all the fish, and that's how they get them. So that's more or less what the Democrats are trying to achieve, and they pretty much achieved it. And it's funny how nobody's talking about it. Now let's talk about the main crisis, about the paying for it. The prices. If those individuals who get Medicaid straight from the government, or those who get from their employees full health insurance, are more or less covered. But the majority of people don't get full covered. And the Affordable Act Care drove up the prices. Before the Obamacare passed, most states you were able to get a regular family plan for $300, in some states even less. And the reason why the other states didn't have, because most states do not regulate what a health insurance means. So the health insurance had the right to make multiple policies. It's like saying, this policy covers only for very expensive things, such as cancer, transplant, or diabetics, whatever, anything that goes to extreme number. This policy covers a little bit more. This policy covers more. Oh, you want a policy that covers everything? You're going to pay $18,000 a year. How do you call it? And then, but most people didn't choose the most expensive policies, or you had the choice at least, which one you wanted. So if you wanted just to cover very expensive things, you shouldn't get into big debt. You paid very cheap. The option was there. And then there was a few states like New York, California who regulated, and they said no, you have to cover everything. But even when those states said you have to cover everything, they didn't do it as far as Obamacare did it, which Obamacare actually increased, put into the bill more things that's not even related to healthcare. So one of the things is about if a person identifies as transgender, the health insurance has to pay for the medical. Which, in my personal opinion, if someone then wants to become a transgender and actually do medical procedures on it, shouldn't be covered from the first place. I believe it should be outlawed to give any of those kind of people health insurance from the first place, because the fact they're showing all those people who take all this kind of medicine, the hormones, whatever they're called, I don't even know, steroids, those people they don't live too long, they get very sick, and it ends up costing for the health insurance a fortune. So why should everybody suffer because those people have decided I want to change? You want to change? Go ahead, change. Just leave me out of my pocket. Gotta stay out of my pocket. And in the meantime, not only you don't have a right to deny them, you have to cover all the expenses because it's considered a mental illness. That's what it says in Obamacare. So this is one expense which insurance have to calculate when they give a price to every person. So that's why prices went up. And then you have the other thing, let's say, about sober living. Those who don't know what sober living is, after rehab, or someone who was an addict and he went to rehab, after rehab, the existing is sober living, where you live and you eat. And the sober living basically helps you get back into life as a normal person, not as an addict. So the sober living basically gives you food, shelter. They provide you with basic covering of life, and they help you get a job. So if a person has health insurance, they have to keep you in that sober living as long as a person wants to. That's what it says in the Obamacare. This costs a fortune, because it's not like, okay, a half year sober living, 1 year. It's like people, all you need is a premium to pay for health insurance. So if a person makes some money and he gets a premium and he was in rehab, and he gets a health insurance, especially on the Obamacare, which he doesn't pay that much, could turn out to be that his expense to stay in the sober living is cheaper than to have his own life, because all he needs is a premium for health insurance, and the health insurance is basically supporting him. And a lot of people took advantage, and they're still taking advantage of it. So this is just the big things that end up causing a fortune for health insurance, stuff that has really no relation to health insurance and no reason why the simple person should have to suffer and pay for this stuff. And it doesn't go in anything in health category. And the fact is that they're forcing the health insurance that they can't give you a plan that doesn't cover anything, only these things. So this causes everyone to pay more money for their premiums. And that's why health insurance is so expensive. So the whole Obamacare caused nothing more than a destruction in the United States. That means we'd be better off if we could just take the whole Obamacare and just repeal it and go back to the way it was before, even though it was a lot of disasters before that. And I had a big question, which I asked a lot of people, and I never, ever got an answer from anyone about it. If we have a problem about health insurance, about people who cannot afford health insurance, there's this such a thing as called Medicaid, which anybody in the poverty level is qualified to get it, which they get free health insurance. Now, the way Medicaid works, if you make a certain amount of money, you're qualified, you make $1 more, you're cut off. You can't get any Medicaid. Like as if this dollar is going to help you pay health insurance. So why does this number, let's say the number is 20,000, just shooting a number, it doesn't have to be anywhere close to it, whatever, let's say 20,000. So someone makes $20,000 a year, is qualified for Medicaid. If you make $20,000 and $1, $21,000, let's be realistic a little bit, $21,000, that $1,000 has to cover you Medicaid. Doesn't make any sense. So why can't you just make, let's say $20,000, you get free health insurance, you make $21,000, you have to add $100 a year, or whatever the number should be. You make 25, let's say for every $1,000, you have to add another $100 to $200 a month or a year. So slowly, gradually, if you make a certain amount of money, you're already considered the middle class, then you're completely on your own. But if you make less than that, you qualify to Medicaid and you have to add payments for it. no matter who asked that question, nobody had what answer. So that could have solved the whole healthcare issue. I mean, the main thing about people cannot afford it, that issue, could be completely solved without passing any affordable healthcare act, anything like that. We could just pass it like that. And it's been my claim since I've been very young, and I still claim the same thing. And so far, nobody's doing nothing. We need to get together and create a movement politically to fight all this injustice, this unfairness, and as I like to call it, this evilness of what's going on with healthcare. And if we get together and we get the right politicians into office, we will be able to fix this whole issue, and so be able to fix a whole bunch of other issues. I hope you all understand. Have a great day and enjoy.